We're celebrating dynamic women here at the Hybrid Soul. Dr. Lynn O'Connor is a friend of the show who has made her mission to provide valuable information about colon and rectal health. She's a highly sought after speaker and expert telling the masses what we need to know about the latest developments and preventative methods, how we can stay in front of this serious disease. She is my soror, and I'm so happy to have her back to the show. Welcome, Dr. Lynn O'Connor. Good to see you today.
Good to see you. Thank you so much. I really appreciate being back.
Yes. My first question is, because since we've talked, it's been some time. We've had different celebrities and different people, even I know, that have died from colon cancer.
Yes.
And it's preventative. What, in your opinion, what is it that we need to do to get the word out more?
It's really important for us to be able to talk about this. And first of all, for people to know that screening saves lives. And the fact that we have seen so many celebrities and family members and friends who have died from colorectal cancer, they need to know that the screening age decreased from 50 to 45. Mm-hmm. And it's been my mission to be on shows like this. I do talks, podcasts, speak in churches, libraries, because it's important for folks to know that. So we have to share our history. We have to share what's going on, and we need to talk to our family members as well. So that's really important to make sure you know your family history, you know your risk, and you get screened.
Do you find it? I feel like we're having to speak to people of color more. What it like, in your opinion, when you get your first time clients coming in, what has been like the apprehension?
Well, you're right. We do need to talk to African American, Black and brown people a little bit more, because we are 20% more likely to be diagnosed with colorectal cancer and 40% more likely to die from colorectal cancer. So I tell my patients that when they come in, because they're apprehensive, they're scared. They're scared of the prep. They've heard terrible things about prepping for the colonoscopy. A lot of my patients wonder if they're going to wake back up after surgery, after the procedure. So it's the lack of knowledge and the fear mostly that keeps people away. And then the other thing is colorectal cancer is silent until the symptoms come. So people say, I feel good. Why should I have a colonoscopy? But the thing is, you want to prevent it before you want to get it, before it becomes a cancer or remove a polyp or a cancer before, when it's early, because that increases survival. So that's the reason why people feel good. So they wonder, why do I need to have it?
Yeah. And you just mentioned, as far as, because a lot of people, even myself, it seems like when I get to 50, that's the test, but the age has gone down. What are some of the symptoms for people, even with cancer? Is it like different stages of that now?
Yes, there are definitely different stages of cancer, but you want to get to a screening colonoscopy before you actually get a cancer. So you want to get to a screening colonoscopy. If there's a polyp, remove it before it turns into a cancer. Yeah. And that's why you screen, because you don't have symptoms. So the average risk person is going to come on around 45. They're going to come in the office and they'll get screened. But if you start having symptoms such as rectal bleeding, change in bowel habits. So when I mean change, like you were normally going every day, and now all of a sudden you're going every 2 or 3 days. It was normally formed and now it's thin, or you can't go at all. You're having weight loss. You start to feel full earlier. Abdominal pain. Those are some of the signs and symptoms that make you think, I need to go see a doctor and I probably need to get screened.
If you have family history of this in your family, is it lower than 45 to go get checked out?
Oh, absolutely. If you have symptoms, it's lower than 45. Just so you know, 45 is just for people who are average risk, meaning they have no symptoms, and that's when they go get checked. But if you have symptoms, all bets are off. Whatever age you are, you need to get screened. In terms of family history, we try to tell people to go at least 10 years before their primary index case for their first degree relative. And a first degree relative is like your mother, your father, your brother, your sister. So for instance, if a patient's mother had colon cancer at 45, they would start screening at 35.
Right.
So why family history is important. At at the holidays and dinners, that's when you should start talking to your family. When everybody's together, know what happened with grandma, know what happened with your uncles, and talk about it because the older generations really don't like to speak about those things.
Yeah, I'm interested in, so you speak all over the world about this. We have an awareness month as far as speaking more about it, but this is something that this is your life. You
Yeah.
do this 365. I mean, you look, take away your weekends and your holidays and stuff, but this is a mission that's very important. Is colon cancer higher in versus as far as gender wise? Because I know we talk about different races, but what about gender?
Gender wise, it's a little bit higher. The highest incidence of colorectal cancer is in Black men.
Mm-hmm.
That is the highest. But then the Black women are right up there. And the only thing that kind of evens them out is that Black women usually live longer. Women usually live longer than men. So the incidence rates between Black women and Black men are pretty much the same because women live longer. But men, they have the higher incidence. You also are starting to see it in Native Americans, Alaskan natives, because there's a lot of access to care that people don't have, especially in the African American community and those other types of communities. There's disparities, there's lack of access to care. So that will drive up the rates as well, too.
Yeah, and I was just thinking about, so with gender and race, what are some things as we are even after you get the colonoscopy, just staying healthy? Are there different
Yeah.
foods that will help us kind of maintain colon free, colon cancer free?
Well, there are foods that have helped try to reduce your risk of colon cancer. And those are the ones where you have a good high fiber, low fat diet. You want to stay away from the processed meats. You want to stay away from the fried, greasy foods. You want to stay away from your takeout. And those are the foods that are going to those are the foods that are going to increase your risk.
Mm-hmm.
Uh, Nitrosamines, I know it's getting warm. We're going to go to barbecue season, but it's those barbecues when you're on the fire and that charcoal type of food. That's, those are what we call our nitrosamines. And those are the ones they're thought to increase the risk of colon cancer. But you want to make sure that you're getting more fruits, more vegetables, more fiber, more water, sort of the Mediterranean diet,
Okay.
beans, legumes, whole grains, things like that. That's what's going to be helpful for your diet. And in addition to diet, you want to make sure you're decreasing the amount of alcohol. It used to be 2 glasses of wine or hard liquor for men, one for women. They're saying no alcohol at all. But if you
Mm.
are, it's always going to be in moderation, at least one drink.
I'm
Folks
like,
who
dang. Look, no baby back ribs, no wine.
no. And I always tell my patients, in moderation, everything
Uh,
moderation. Because if you're going out, you're celebrating, you're on vacation, obviously you're going to relax your dietary restrictions. But
yeah.
for the most part, you really should be having green leafy vegetables. You should be having some beans. You should be having fruits. You should be having whole grains, fish, chicken. You want to stay away from the red meats, the lunch meats, the bacons, the processed meats, the takeout foods. That's just not healthy for us overall.
Just eat air. Just eat air. What is it? What is one thing that the person that is scared to go, that's in their 50s, what is something that you could advise them and encourage them to get their behinds in for their visit?
I have patients who are scared to come. And when they come in, they're sitting across from me. I usually tell them, I can prep you for a colonoscopy, or I can prep you for a colon surgery.
Mm.
One do you want? Because you got to prep for either one of them. And most patients understand that just a little bit of ounce of prevention, is a pound of cure. And it's just addressing their fears because someone who has someone who's had some complication, some perforation, some bleeding. But I have to bring it home to them. You've heard of somebody who's gotten in a car accident. You still get in a car.
Yeah.
You've heard of people who have, you see all these planes dropping from the sky, but we're still going into planes, we're still flying. So you have to kind of meet them where they're at, understand their fears, and really just listen to them and reassure them because this is a safe procedure. The complications with this are almost minimal. Patients do well, and the benefits far outweigh the risks.
Wow. I'm just I'm in awe because when you talk about it, it sounds like it's so easy, but there's so many people who are so scared, not even apprehensive. They're scared
They
of
are.
this procedure. They're scared of drinking all the liquids beforehand and making it. I think it's important to have these type of conversations because we have to bring down that apprehension and
Yeah.
awareness because one of the things that always sticks with me with you is that this is preventable.
Yes, it's preventable, it's curable, it's beatable. And
Yeah.
I tell my patients, colonoscopies, that's the number one modality because it's both diagnostic, meaning you can find a polyp, and curative because you can remove the polyp. But if patients are scared of doing that, I'm saying at least do something. You can do Cologuard, but the problem with Cologuard, it's not as sensitive for colon polyps or adenomas as it is for cancer. So you want to get something that's going to get it before it becomes a cancer. And then
Because Cologuard is just you putting your specimen in the cup and sending it off, correct?
right. And Cologuard is 92% sensitive for a colon cancer. So it does help you diagnose the cancer, but it's only 42% for colon polyps or what we call adenomas. You want to find that adenoma before it becomes a cancer. So that's the reason I shy a little away from Cologuard. But if you're not going to do anything, at least do Cologuard, at least do what we call the fecal occult blood test, where you take a little piece of your stool with the popsicle stick and you smear it on the card and you send it away.
Yeah.
Do something. I think, some test is better than no test if you're not
Mhm.
going to use the colonoscopy. But
My
what
mhm.
people understand though, if those other tests are positive, you will still have to have a colonoscopy.
How often do you have to have a colonoscopy?
Well, it depends on what we find. It also depends on your family history, and also depends if there's any genetic issues or any ulcerative colitis, Crohn's disease, what we call inflammatory bowel disease. But in general, your first screening colonoscopy should be at age 45 with average risk. And the American Cancer Society says every 10 years after that.
Okay.
Unfortunately, my patients back a little bit sooner. I do it every 5 because I've just found 10 years is way too long. However, Kelly, if I find people with polyps that are large, that are worrisome, that have a different type of pathology to them, I may bring them back sooner. We may do it in 3 years. So if someone has multiple polyps, they're going to come back even sooner than that.
What and how are polyps created? How do people get them?
A lot of people ask me that question, and really, what polyps are, it's normal, regular colon tissue that just keeps growing and growing, and it loses the genetic inhibition to stop growing. So that's why you always hear people say, "Oh, that's become a cancer because it spread so much." That's the thing. We have normal, regular cells that just stop. They keep growing, and they don't have the genetic inhibition to stop. So that's where a polyp comes from, and then it keeps growing into a cancer.
And it so would you say uh doing a Mediterranean diet and eating healthier helps eliminate the possibility of having polyps?
It helps with that because those type of foods are healthy for the lining of the colon, what we call our gut microbiome and our colon mucosa. So those types of foods produce short chain fatty acids, and those short chain fatty acids are what is the nutrition for the colon. So you want to give the colon good food. The other
Mm.
is when you're eating those foods, like I said, the nitrosamines and those foods that are carcinogenic, if you will, that will promote a cancer, they stay in the colon for a long time. That's why sometimes people are constipated. And the longer that unhealthy food is exposed to your colon mucosa, there's a thought that that is what may cause cancer. So if you're moving your bowels and everything's going through on a normal, regular basis, the contact from that carcinogen to your colonic mucosa is less.
Mm.
So you don't want it just sitting there and having more contact.
Wow. I was about to buy a barbecue pit, Dr. O'Connor. I feel like
You
a
know,
barbecue pit for the summer.
you can get a barbecue. Like I said, everything in moderation. You could put some salmon on that barbecue pit. You can put some vegetables on that barbecue pit.
Okay.
You can kind of have a little bit of the best of both worlds. You can grill too. Uh,
Yeah.
you want to have fun. You want to go out. I mean, everyone's going to have some cake. Everyone's going to have ice cream. I have a sweet tooth that's crazy, but you have to moderate it.
Okay.
And the other thing that's going to be important is exercise. If you can just exercise 30 minutes a day, 5 days a week, or at least 75 vigorous minutes a day for 3 days a week, that goes a long way to preventing colon cancer. And there
Okay.
was a that found that patients who had colon cancer, who were treated and the cancer hadn't spread, if they just increased their exercise to what was recommended, they could reduce their cancer risk to at least 20% by 20%. So
Wow.
exercise makes a difference. And also sleep. There was a study that found that if people are sleeping more and they're sleeping better, they can reduce their risk of adenomas, which are those colon polyps. So that whole thing. And the other thing we have to talk about is obesity. Overweight and obesity, that increases your risk not only for colon cancer, but so many other cancers.
I love that. I love that. It's so simple, but some people are, I'm not going to say hard, but challenging.
Yeah,
But if you want to live, do these simple things. Do
you
these
got to
simple
work.
things.
You absolutely
Yes.
do the work, and
Yes.
it's a lot easier to go to a drive-through and get a cheeseburger than to come home and cook. But you
Hard. Yeah. But it's worth it to live a long life.
know,
So easy. I want to congratulate you too for making history, becoming the first Black female surgeon for New York. That's
thank you.
amazing. And also want to give you kudos outside of all the great work you do for colon and rectal health, working with the kids. I just want to speak briefly on that. Because you're really want to encourage kids to get involved in STEM programs and promoting math and sciences. Please talk about that with young Black girls.
Yeah, it's really important to me that they look up. A lot of young Black girls look up to me, and I mentor. But and it's not only just a STEM. It's actually I tell them about STEAM as well because we sometimes often forget about the arts, and the arts are important as well. They don't get a lot of attention, but science, technology, mathematics, arts, all of that is so important for our young girls to know that they can do it. By the age of 5, most young girls are turned off from math. They're told that they're not as good. And they're also getting subliminal signals that they need to dumb themselves down to be accepted.
Yeah.
So important that we show that strength and we show that the value that they have. And that's key for me. I do a lot of mentoring, I do a lot of teaching, I do a lot of lecturing and a lot of volunteering.
And I kudos to you for all the great work that you do. And my final question is, what would you tell a young girl who looks up to you, who is really trying to find her way? What's some words of wisdom that you could tell from your journey that you could encourage her?
I would tell you never give up. If I had $1 for every person who told me I wouldn't achieve something, I wouldn't do something, I wouldn't be something, I wouldn't go anywhere, I could retire and be a millionaire. And it's really unfortunate. I would tell them never give up, believe in yourself. And the other thing is be careful who you tell your dreams to. Be careful who you tell your goals to, because there's always somebody who may be a little bit more, they may have their own insecurities and they'll put their insecurities and their fears onto you unknowingly.
Yeah.
So you got to believe in yourself. I think also having a firm grasp. For me, it's religion. I believe firmly in God. But I mean, even if it's not, whatever entity, whatever universe you believe in, hold tight to that and believe in yourself because if you just keep at it, you can make it. Because if you never try, you'll never know. If you don't
Amen.
get there and you never try, you'll never know. What do you have to lose? Just keep doing it and believe in yourself. Surround yourself with the people who are going to support you. Surround yourself with the people who are going to be by your side. And the other thing I would tell them, do not be the smartest person in the room. I've heard that a lot. Make sure you are not the smartest person in the room. That means your circle has to be varied.
Yes. Thank you so much. It's always a pleasure to talk to you because you're saving lives. And
Thank
that's
you.
so important. That's so important. I always look forward to having a conversation with you, learning more about colon and rectal health and just health in general, because these steps will save lives. And that's what you're doing. So thank you once again. My guest today is Dr. Lynn O'Connor. Please, if you haven't got your colonoscopy,
Yeah.
please make an appointment, get that done because it's so important because we want to have you here as long as you can. And I want to thank you once again. It's Kelly Kinkaid, your destination for music and culture discovery. And my guest today is Dr. Lynn O'Connor.